Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. We're back in the studio this morning, treatment room 1. We got a special guest with us today, Dr. Dee Whelchel. How are you doing this morning?
Hi there.
So Dee is with Equine Medicine Consulting Services. You're an internal medicine and cardiology consulting practice out of Alpharetta, Georgia. Correct?
Yes, correct.
So Dee does consulting for us here at Countryside. She helps out a lot with advanced internal medicine cases and cardiology services. But you also travel to other practices as well when they need your specialty.
Yes,
correct?
I do. Mm-hmm. I do.
That's awesome. We got Dr. Brown back with us this morning. So I want to kind of dive in today. So Dr. Whelchel, you're a boarded internist, correct? Explain kind of tell us a little bit about yourself.
Okay, so yes, I'm a boarded internist. So that means basically after vet school, I did an internship and then in 3 years of a residency training program that focused in internal medicine for large animals, horses, also some cows and pigs and other things. And then with that, you pass an exam and you fill some requirements to become board certified with the American College of Veterinary Internal Medicine.
And one of your areas that you also focused on, and it's going to be kind of the top of our podcast today, is you did a lot of work in cardiology, correct?
I did. And so although there is a separate college for cardiology, there's not a lot of large animal cardiologists out there. And
Right.
A lot of the people who even specialists in cardiology through that college really do more small animal. We're starting to see more interest in equine, yay, and large
that's
animal.
what we're talking about.
But because of that, that's sort of fallen on the internist, the large animal internist, that they need to have that in their wheelhouse. And I was fortunate enough in my residency training to work with people who were very interested in that, did a lot of research and growth in equine cardiology. And so it's become a passion of mine as well. And I've continued to hopefully continue to push my skill set there. And it's part of medicine I really love doing.
That's really cool because, we're going to talk a lot about the heart today. And, thankfully, it's not a common issue in horses. The problem is it's got some pretty high consequences.
That's right. That's right. And, we talk about our kids who play football and are more elite athletes and how we're looking more at their cardiology health and making sure we're doing screening testing and things like that. Well, we have equine athletes that some of them we're asking quite a lot of, and then we have a person on their back as we do that. So that's right. When there might be an abnormality, it has more significant consequences for horse and rider.
Absolutely, and that's part of here at Countryside. One of the things when we do vaccines, down here in the southeast, we vaccinate twice a year. Well, part of our vaccines is not just going out and giving your horse vaccines. A big part of it's that physical exam we do, and we're going to do this every time we look at your horse. And a lot of that is we're screening for these cardiac issues. It's just part of our normal everyday work. I know you do quite a bit of that.
Because that's, I'd say, probably the most common instance I find something random is just on a normal physical exam for a vaccine appointment. And we're just taking a listen to it. And even if we've listened to that horse before, we're like, oh, this is different. We've never heard this before.
Yeah, it's a really big part of just normal physical exams. We've got to check the heart because, like I said, the incidence is fairly low. It's just the consequences are so high, because especially we're on their back. So let's kind of dive into let's just get right into what's going on here. When you go out and you're listening to the horse, there's two basic things we can pick up. We can pick up murmurs, and we can pick up arrhythmias. And so let's kind of talk about those. Let's dive into murmurs. Let's talk about that a little bit. Like, what is a murmur?
So a murmur is basically caused by turbulent blood flow in the heart, and sometimes that can be even normal, what we call a physiologic or flow murmur, because horses have big hearts and big vessels that blood is constantly being pumped through, and pump through with pretty good force and a pretty big volume of it for a big, large, again, 1,000-pound horse. And then we can have pathologic murmurs, and those are probably most commonly caused by leaky valves or valve disease, but sometimes can also be caused by some congenital defects in the heart as well.
Because the cool thing about the equine heart is it's not much different than ours.
No.
I mean, it's the right side, its job is to pump blood to the lungs, get it oxygenated. The left side sends it out to the body. And the cool thing about a horse is it circulates its blood volume every minute.
It's amazing.
Yes.
When you think of 40 liters
40 liters.
of blood.
At rest.
Yeah.
And that's
At
just
rest.
Yeah.
hanging out. Yeah.
We don't do that as people. I think
No.
we're 80%. Is that right?
Something like that.
I don't know
It's-
the exact percentage, which I should probably, but of humans, but it is less. And then that's also something that has to with horses. Sometimes, the one thing is, he's doing just fine. You hear that murmur, but he's exercising fine or everything's fine. Well, there's a lot of what we call reserve capacity with a horse, which means they can kind of get away with a lot.
Yes.
And sometimes something sneaks up on us.
They can till they can't.
Exactly.
Yes.
And then it's a problem.
Then we
So-
got a big issue.
Yeah.
So-
and that's why these routine listens, I was so excited to hear you talk about that. The physical exam, twice a year physical exam is a really important part of our horse's health care.
Because, you're on the back of this horse, your child's on the back of this horse. A cardiac event is a horrifying thing.
It is.
Yes.
So
We were looking at some stats before this podcast of just, how common is this? And, I think most of these events that they were showing up was on a racetrack or on a training track. And there was a statistic of they think that maybe up to 50% of deaths on a racetrack are related to cardiac events. It seemed like a lot, but
It is in those elite athletes that we're pushing to max performance, certainly it is more than you would expect as a cause of death versus like catastrophic fractures and things like that would be the other big ones. But it's a huge area of research right now as well to understand what we might pick up on those horses, but we'll get into that a little bit later. We're going down the rabbit hole here. We'll come back to murmurs. So
let's get on to murmurs. So, Dr. Brown, when you're out doing your physical exam, what are some things that like you're going to listen? All of a sudden, boom! It's like, all right, we need because this is one area that as general practitioners, I think this is one area that we don't get highly involved in because it is so specialized. Even you talked about it in the College of Internal Medicine, you have internists that do cardiology and those that don't. It's a very highly specialized field for good reason. And so what are some of the things, like when you go out, what's your first clue? Like, hey, we need to do, we got to call a cardiologist.
Right. So, again, like what we said, most of the time we're just doing a routine exam. We're not expecting or looking for anything. We just pop our stethoscope on these guys and all of a sudden you're hearing gurgling or, some abnormal noise, because that's what murmurs are, it's just noise. And so, our first thing is we're going to try to characterize what we're hearing. So there's a grading scale of murmurs. So anywhere from a 1, which is pretty quiet, to up to a 6, which is you can actually feel it on their body, which is insane.
That's crazy.
Those are crazy. Those ones are wild. I've had a couple of those, and those are a little scary. But so we're going to characterize it. So we're going to listen to both sides of the chest to see where it's the loudest, because that can help kind of pinpoint to where that murmur might be originating from, which valve it's coming from, and then listen to where it occurs in the beat. So the lub-dub. So there's kind of different sounds that we have, and depending on where it is will tell us whether it's a systolic murmur or a diastolic murmur. And so once we can kind of characterize that and then, get an idea, I'm going to talk to the owner and say, hey, has anyone ever heard a murmur on this horse before? Is this the first time that anybody's mentioned hearing a murmur to you? Most of the time it's, well, no. And, we'll look back at our own notes and see if anybody's ever heard something. And, at that point, that's where I start trying to get a little better understanding of, well, what is this horse doing? Is this horse just hanging out in a pasture? We're not doing anything? Or are we riding this horse? Are we competing with this horse? Is there a child riding this horse? And so once we kind of get an idea there, we can decide, hey, let's get a little more, involved in this. So, that's where I might reach out to an internist and figure out, is this something that we need to further evaluate with some imaging?
So when we talk about that, we hear murmur. And my rule is like if this horse is being ridden and it's got a murmur, you now get to have a cardiologist in your life.
Yes.
Because this is something we need to know. Because there's murmurs that are an issue and there's murmurs that are not. So, Dr. Whelchel, let's kind of dive into that.
Okay.
Like when we'll give you a call. You've actually got to do a couple today for us. We've got these murmurs. All right, what's next? What are you, when you get here, how do we start figuring out, like, is this a problem or is it not?
Well, obviously, I'm going to listen to the horse and do a thorough cardiac exam as well. And certainly if we hear murmurs along with higher heart rates, of any arrhythmia, that's automatically a whole different category versus, okay, I just heard this new murmur. But really, I'm going to do the same thing as classifying it by how loud it is, what's the timing of it, things like that. And certainly things that are grade 1 and 2 tend to be less of a worrisome murmur. That being said, the only way to really know is to do an ultrasound of the heart called an echocardiogram, where we can actually ultrasound the heart, the valves of the heart, put color flow Doppler on, see if there is blood leaking back across that valve when it's not supposed to be, when the valve is closed. That's the most common time we'll hear it in horses. And then also we can see if there is a leak, is the heart having any other consequences because of it? Meaning we're starting to see some enlargement of the heart or enlargement of certain chambers of the heart, some changes in contractility of those chambers, things like that. So that helps us really grade what we're dealing with as far as true valve regurgitation. And sometimes we don't find anything and it's just what we call a flow murmur, and we can document that. And that's a great thing. That means, okay, this is a horse we don't have to follow back up on. We know this is not a problem. But again, better safe than sorry, especially with an athlete that's going to have a kid on its back or a person doing high-level work, things like that.
Because even with lower level, like grade 1s and grade 2s, you can still see the enlargement of the heart, thinning of the wall. I mean, it's not as common, but these can still be an issue.
They can, and the thing is that sometimes, I mentioned we tend to be less worried about the lower grades, but we could have a horse that had maybe a higher grade murmur, but as the heart function deteriorates, that murmur can become less loud to our ears.
Oh,
and that's why
Yeah.
it's important for us to follow with echocardiogram, just to know. Again, that's not the common, but that's maybe the horse that's had, advancing mitral valve or advancing aortic. At the end of the day, as the heart starts to decrease in its functionability, its contractility, those noises can become less dramatic.
Interesting. Yeah.
That's very interesting.
I think I've even heard some, like, in our rescue population where we get a lot of these horses and they're malnourished and extremely underweight, and you're hearing these weird murmurs and then they put a little weight on and all of a sudden it's gone.
I have that as a common thing that we look into, and I find that very common. And a lot of times it worries me a little less when I hear one that sounds louder on a skinny horse, because I think that some of that murmur is radiating a little further just because the horse is so thin. But again, the only way to know is to do the heart ultrasound. And again, that horse has also been through a harder condition. It could have had something going on where maybe it even had an infection on its valves earlier, or, so it's worth looking into. And then this is so hard to say about a rescue because we love them and we want to help them, but sometimes there's a reason they've sort of passed through the rescue situation. That's because there was something going on and people just dumped them. And so you want to make sure, again, that that's not a cardiac problem. That's why it's ended up there. So
I think a lot of cardiac issues do go undiagnosed because, it's not how on our list it causes a poor performance, but it definitely is.
You're right.
Like if your heart's not working the way it should, your performance is going to decrease.
It is. It is.
I think the craziest one we had, remember that thoroughbred we had that was, it was the thoroughbred we had that almost had a tetralogy of Fallot, but it somehow lived to be 3 years old.
Yes.
Yeah, 3-year-old thoroughbred with tetralogy of Fallot.
Yes.
And it wasn't running well, and so it ends up being rehomed, and it's going to become a sport horse because it was slow. And it gets to the barn, we go out and do a physical exam, and it is literally 3 years old with tetralogy of Fallot, which is where you have septal defects, you have valvular defects. I mean, these horses don't normally live past about maybe, what do you say, like a week maybe?
Honestly, yeah, usually it's a week, 2 week. Often those are, I think, foals that end up in some sort of NICU, ICU, because they are doing so poorly at home. And a vet hears these things and they look further into it. I mean, they're on oxygen to just make it. So no, that is stunning.
Yes. Made it all the way to the training track with people riding him.
But yeah, we do see things like, VSDs where they have a little septal defect that creates a really loud murmur, but those horses race and do well. It all depends on the size, how bad it is, and it tells you, going back to your case, it tells you a lot about these horses have this huge heart and drive, not, but their spiritual heart, and they're wanting to perform, and nothing's going to stop them, kind of thing, that we can't always rely on that.
Yes. So, we got those murmurs, getting that echo and understanding what we're dealing with and getting a plan together. That's one of the things we talk a lot about on the show is having accurate diagnoses, accurate early diagnoses, being able to formulate a plan, because just because your horse has a murmur doesn't mean the career's over.
Exactly. It's really important to document what I'm going to call a baseline, so that we say, okay, here's where the murmur is right here and now. And a lot of times, I'd say most of the cases, that horse is still going to be able to perform and do its job. Particularly when we have good veterinarians listening to these horses and doing their routine physical exams on these horses. That's the goal, catch it early. Sometimes it's something we're just going to follow up once a year on and just make sure that everything stays stable. The only way we're going to know how fast it's going to progress is by re-ultrasounding, following the horse either every 6 months or annually, depending on what we're finding. And then 2, sometimes there are medications that do help, and they help slow progression or even sometimes improve cardiac function in the face of that murmur. I've had one case recently that I was, 6 months later after we started on medication, things look a lot better, and that horse is still in work. It still is used as a lesson horse.
Wow.
And now, is it, it's an older horse anyway, so it wasn't, again, asking what the horse is used for is really important. This is not a horse that's going and running a 3-star cross country, but, it's very capable of doing what it's doing right now. And yes, it will have a cardiac appointment annually as making sure things stay stable.
I had a high-level jumper that for years, it just went down once a year, got his cardio workup. Everything was good. Yeah. Every time we're listening to him twice a year, it's like you have a murmur, but it's okay.
That's right.
Like none of us are worried because we've got that yearly exam, and it's like there's been no progression. Everything's doing well. Heart still functions like it should, and this horse had a completely normal career.
There's a lot of times they're going to have a completely normal career, and there's something else that's going to cause them to have to retire, like a lameness issue or things like that. And then, too, also I get with clients, oh my gosh, is this going to be what kills my horse someday? I hate to go that dark but so early, but anyway, it often is not. More than often, it's not. But again, there are certain cases that maybe are going to progress to congestive heart failure a little faster than others, or the horse lives long enough to get to that point. But again, these are not always career-ending things. More than not, they're not. Or again, life-threatening. But we just have to understand and have a baseline, have the right diagnostics to know what we're dealing with, so that we do treat it appropriately and we do make sure everybody stays safe as we go forward.
Yeah, a lot of times where I find these sometimes is during a pre-purchase exam.
Oh, yes.
That seems to be where they come up, and sometimes it can be at rest, and so then sometimes it's after exercise. We pick up on these, and it's like, all right, hold up, this is here. It's not the end of the world.
Right.
It just means we've got to go look deeper.
That's right.
And some of them are there, call them innocent flow murmurs, where we may hear them at rest, but as soon as we start jogging the horse, the murmur goes away. Yes, that's most like an innocent flow murmur, but I'm still going to push, like, let's verify. Let's verify, because this is not, and that's the other thing. When you talk about a heart workup, people get very nervous when we start talking about a cardio workup, but really if you look at it monetarily, it's no different than having a thorough lameness exam.
That's right.
I mean,
economically, it's not crazy expensive.
Right.
No, it's not something crazy.
It's a lot less invasive.
Yes. Yes.
I was talking about. So, and the information you get is probably, in my opinion, is more valuable than what we get off a lameness exam, because this isn't just performing; it's safety.
Well, I think they both have their importance. I don't want to step on any of the lameness.
No, I'm a lameness guy. I said it. That's what I do all day.
But I do think one other thing is with lameness, it's something that a rider is going to go, oh, my horse is lamer today, or
Right.
it's worse, I can't push, versus the heart, you may not realize the subtle changes. And that's, I think that's another thing that makes it really important to just get the diagnostics done.
Right.
So, yeah, the horse needs 4 legs to do its job, but it certainly needs a heart that's functioning as well.
Right.
So, yeah. And you made the comments about, before, after exercise, all those things. And again, things can change and act differently. Really, the only way we know is to do the diagnostics. And our ears can sometimes fool us too. There's
Yes.
just
yes.
so much that we
Yes.
can, we don't have the crystal ball, as far as just what our physical exam can bring us. So.
No, a physical exam gets us to the point where, I always say, all right, we pick up a murmur, and we're going to talk about the arrhythmias in a minute. We pick these up, and it's like, okay, we need more.
Yeah.
We need to know more.
We just need to know.
Yeah.
Yeah.
And like I said, getting and one of my favorite things is to watch an echo, because it's so cool. Like when you're looking at, most of the time in lameness, everything's like still. It doesn't move. And it's so cool when you watch this thing live on a screen and you see the valves functioning like they should or not. And you're actually seeing blood flow through. I don't know. It's a cool thing to watch.
I like the fact that Dr. Carter likes to nerd out just a little bit in the internal medicine
I
side.
will nerd out. I'll
I
be
know.
honest.
It's like, oh.
I will become a little bit of a nerd there. So
It's a fun exam.
it really is. Yeah. I enjoy it. And I wish I could see color better, but when y'all do the colorful, I'm not real good at color. But when you put that on, it's so cool to watch. I don't know. It's like you're watching something work, and it's really, and the fact that it does, I think that's what amazes me.
I think it's what I'm amazed is like we can bring this technology stall side into
Yeah.
it.
Yes.
Like, and that this horse stands there and, usually they tolerate it pretty well. And it's non-invasive, like you said. And, just that we can do that. And you think about 40 years ago, 50 years ago, I mean, where was it even for humans? And it's fun to look at some of the older images of the textbooks, just like lameness. And,
Oh, yeah.
And now you look at these awesome images we're getting on our newer equipment. And it's
That fits inside of a suitcase.
Yeah.
Used to, you had to roll this massive machine
Yes.
out. And that's not that long ago.
It's not that long ago. That was vet school
Yeah.
for
Yeah,
us, right?
Yeah, I was going to say, 15, 20 years ago, you're rolling this massive console
Yeah.
out.
Yeah.
You feel like
I've
the
done-
lights were dimming when you turned it
Oh,
on
yeah.
from the power draw. And now they're about the size of a laptop.
I
and
have the one on my iPhone, like that's
Yeah.
Yeah,
and
the butterfly.
and like I like just randomly scanned over a heart before. I'm like, hey, look at that! Like that's
really cool.
It's a really good image for being on your phone. Like
It's just like a quick, okay, is
Yeah.
there pleural fluid? Is there pericardial fluid? I mean, there's some quick triage, flash scan. It's
How
great.
fast
Yeah.
do you need to get to the cardiologist?
yes,
That's awesome.
So murmurs are one thing that we pick up on, and like I said, that's the abnormal noise that's in the heart, and we'll talk about arrhythmias next. This is where we have abnormal rates and rhythms. Like the one thing I love about listening to most hearts is it's just sitting there very consistent. I mean, almost lull you to sleep, just dum 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 dum.
Especially
dum,
the
dum.
horses.
yes.
Oh, I'm telling you.
So it was always so funny in vet school. Some of my small animal friends were like, "It's too slow to count." I'm like, "What?"
What?
I
Like,
said, "I never got a cat heart rate. I'll tell you that."
Oh my
No.
goodness, I agree. Cats.
I feel you're just like 225.
Yeah, 200. That was my go-to
Yeah.
with the cats.
A horse you can actually count.
They're like, it's
Yes.
too slow. I can't hear it.
Yes.
I'm like, what? Like, you can hear the whole thing.
I remember I had an owner call me one time, and I was headed out for a colic, and then she was getting a heart rate. She's like, heart rate's 125. I was like,
No, it's not.
No, she says 250. I was like, no,
No,
it's
it's
not. It's not
If it is,
250. Let me go back and recount. I was like, okay, lub dub is 1. Lub dub is 1. And she said, okay. You call it, never mind, it's 40. I was like, that's better.
That sounds right.
Not 250. I was like, it is not 250. So let's talk a little bit about arrhythmias. This is abnormal rate, and I guess that's the best way to describe it. It's an abnormal rate or rhythm of the heart.
Yeah.
So let's talk a little bit about arrhythmias.
So arrhythmias basically is when we have, they're caused by typically a conduction disturbance in the heart. And yes, it's what's responsible for generating our heartbeat, our lub dub. And there are some arrhythmias that can be also physiologically acceptable or normal, particularly for the horse. And then, of course, there are others that are abnormal and that pose risk. And arrhythmias, where they get scary, is that those are the things that, again, if our rhythm is abnormal, particularly under an exercising condition, we can have risks for that horse having sudden cardiac death. And there's certain types of arrhythmias that risk is very low for, and others that it's got a higher propensity to be an occurrence. And especially in elite athletes where they are pushing high heart rates, running a racetrack, or again, cross country, that type of thing. But I've had a case where a horse collapsed because it just went into AFib. And that very moment it went in, it fell down, trainer was on it, they both fell, trainer broke its collarbone. And again, that in itself, atrial fibrillation is not a cause of sudden death, but it caused that horse to just kind of have this stunned reaction when it went into right then. So again, bottom line is, and we can talk more about types and things like that, but they are of a concern to make sure we understand and make sure it is not one that's what we call pathologic. And not every time is that necessarily a performance-ending thing, but it is often something we're going to treat and recommend converting.
Yes.
Yes.
If it is sustained. And some arrhythmias come and go, and sometimes they're caused by other things. And that's the other thing, is getting to the cause. A lot of times, the majority of times, an arrhythmia has an underlying cause that we can fix without having to do something as invasive as cardioversion, like an electrolyte disturbance. So we're going to check blood work. We're going to check cardiac enzymes, just like a human that might be having a heart attack type situation in the hospital. There could be, sometimes some weird stressors in that horse could trigger little arrhythmias. Sometimes colic. A horse could just have an arrhythmia during a colic, and then it goes away when they're back to normal. So other pathological problems going on.
Now, arrhythmias are really cool because when you study the heart, kind of getting back to basics on it, there's not a nerve impulse that starts the heart beating. You have got this little group of cells that just
node.
The SA node, and it's just this random group of cells somewhere in the heart. I mean, we know about where it is, but their whole job is like, okay, we'll maintain the electricity and the contractility of the heart.
Yep, pacemakers.
Yeah, it's a little pacemaker.
Little pacemaker cells.
Yeah, there's not a nerve doing this. The brain's not telling your heart to beat. It's got these cells. And they're like, you know what, we're in charge of this.
Yeah.
And sometimes those cells go haywire, and we got to go get them right.
Right.
Oftentimes you're right. Like we don't see it as much, but back in, I always think, when I think arrhythmias, I think about quarter horses. And I think about the impressive bred quarter horses that had the HYPP. And all of a sudden, this potassium has gone haywire.
Yes.
And they can get some really interesting arrhythmias when this happens.
Yes.
But again, you fix the HYPP and that goes away.
Goes away. That's right.
Same thing like low calcium.
That's right. Low calcium is a big one. We'll see.
The colics.
Colics, cantharidin toxicosis. All that.
That was
calcium.
You probably don't remember it, but Dee was a resident when I was in vet school at Georgia, and there were the horses that came in and had the cantharidin toxicosis.
I do remember that.
And I can remember it was one of the coolest things I ever watched. Is they had hypocalcemia, they had these weird arrhythmias, they couldn't hardly walk. You figure out like this is what's going on. And I remember I was squirting calcium into a bag. We start hanging it, and I'm watching this horse with this crazy arrhythmia, and then just the way it walked, and like the calcium starts flooding in. And within minutes, life is back to normal.
Life is back to normal.
Wow.
I was like, okay.
Yes.
This is some cool stuff here.
Yes. Electrical cells do not like, cells do not like massive electrolyte disturbances,
No.
particularly calcium. But yeah, we had some cases that it was crazy how many cases we had that year.
It was
Yeah.
wild. I remember that one barn had 20-something cases.
Yeah.
It
Yeah.
was,
Wow.
it was absolutely
That's
insane.
wild. That's like,
Like the first one came in and we figured out, or Dee then figured out what was going on. And this guy, all of a sudden, he just turns ghost white. He's like, I've got 20 more at home. Or maybe even more than that. And like it was all hands on deck. It was a crazy.
It was crazy.
Yeah.
that's,
But yeah, so electrolytes.
that's textbook right there. That's
Oh,
that's
it
like
was.
that's like one of those like boards questions.
I never
scenarios,
forgot
like,
it. I have never forgotten that. I was like cathartotoxicosis, hypocalcemia.
Yep.
Like I have never forgotten it.
Wow. That's
And even and the other thing is like that's cathartin, but one of the ones we see a lot is thumps or synchronous
Yes.
diaphragmatic flutter, where horses. I had a really cool one actually came in for a poor performance, and they thought the horse was lame, and I literally jogged the horse down and back, and it starts thumping.
Oh.
And I was like, is this what it does? Like, yeah, it just breathes really heavy. I was like, this isn't it. And sure enough, calcium is tanked. As soon as it exercise, calcium tanked. And we finally got him sorted out. But that's a really cool one. We see it a lot in racehorses too.
Yeah.
They burn through their calcium during exercise. Eventers can see this too. And basically
Endurance.
endurance a lot. And like I said, it's really cool because it's an arrhythmia. You hear it, you can actually see it because it basically every time the heart depolarizes, it makes the diaphragm.
That's right, because
trigger.
and sometimes there's not necessarily arrhythmia with the heart, other than a little bit of just higher heart rate. But
Right.
the nerve going to that diaphragm crosses over the heart, and so it just becomes more excitable when that calcium plummets. And so every time the heart contracts, it just fires that nerve. A lot of people think their horses are having the hiccups. That's
Yes.
another
Yes.
complaint.
That's
Horse has the
I think
hiccups.
the one call that I had for it, they were like, it's almost like they're hiccuping. I'm like, oh, we're thumping.
Yeah.
Yeah.
Let's get some calcium.
Yes. Yes.
And it's cool because the calcium goes in and it just goes away.
It just goes away. That's right.
So it's a lot of fun. So other things like when we're trying to figure out an arrhythmia, this is when we're going to look at another specialized test. We're going to get into the ECGs.
Yes. And so that's just like you, when you go to a doctor, particularly you start to get, over 60, you're going to have your annual EKG done,
Yeah.
ECG. But that is how we also help define an arrhythmia, because that records the electrical conduction in the horse. And we do it at rest. We often do it while we do our heart ultrasound, so we can kind of look at timing. But we can run one at rest, and then we can run one under exercising conditions.
Those are really cool.
They are cool.
I like the
They're
exercise ECGs.
And that really is probably the height of being able to say, hey, is there a problem in the rhythm that's causing a performance issue in this horse? Or is there a rhythm that's going to occur when this horse is exercising at its expected level or a little beyond? That could be, a worrisome thing for this horse as an athlete. And then there's also 24-hour monitoring, where we'll put a Holter monitor on. This is done certainly to understand arrhythmias that could come and go, or what we call paroxysmal arrhythmia, which often can happen, or I shouldn't say often, but can be one of the manifestations of arrhythmia in horses. But also horses that collapse or have syncope episodes.
Yes.
There's a laundry list of causes for that, including things like sleep deprivation. But we often have to take the heart problem off the table by
Right.
doing that Holter monitor and making sure when that horse does have that sleep deprivation episode and collapse down, that there's nothing wrong with the heart going on there.
And that's another place where technology's really changed, because I can remember used to get that Holter study, we got to ship them into a hospital. You got to get everything hooked up. I mean, it was a big process, but now Penn will just send us down the Holter monitor.
Wonderful.
We hook everything up, let it run its
Yeah.
course 24 to
Yeah.
48 hours, put it in a box, mail it back.
That's right.
It was
And
so easy.
it's so easy. And now with all our camera systems that we can do, these remote camera systems where we can actually record the horse as well and see what they're doing while we're taking that Holter monitor, and then send everything to Penn, and they have a behavioralist that will work with the cardiologist and look at the timing of these events and go through all of the recordings, which is pretty cool, I think, pretty helpful
Yeah.
to have.
I cannot think of a worse job, though, than being the guy that has to sit there and read through
That's some
20
resident. Some resident's getting stuck with that. That's not a clinician.
This is one place
Or
I
a
hope
fellow.
AI has gotten involved where it can at least spit out like this isn't normal.
That's a really good thing you just brought that up. So
Yeah.
not that I know of for the video yet, although I'm
Right.
sure that will come, but absolutely for the EKGs. And that's becoming a big thing for Halter monitor, 24/7 Halter monitors. Actually, the system that we'll use today, if we look at a horse for getting an ECG or an exercising ECG, it's called Televet. And they are starting to incorporate AI in the software. And basically it'll run through. And what I like about this is it just points out the places that are questionable. And then
Right.
you as the vet get to decide still, hey, is this, just a little blep
Yeah.
that's artifact or this is real, and then go through and it can help identify those. So yes, that's nice.
It's pattern recognition,
Yeah,
AI.
absolutely.
So
Yeah, 'cause if you thought about that, let's say there's like just make math easy, 40 depolarizations a minute times 60 minutes an hour. There's 240
That's right.
over 24
And then you
hours.
exercise that horse
Yes.
and get its heart rate up above, up to 200 or
Right.
180. And yeah, there's
a lot.
And
Poor
it's
rest.
messy. It's not an easy, I just want to say messy. That's a much harder ECG to read when they're going fast like that.
Oh,
and
I
they're
bet.
galloping.
I do
So,
not. I all I can think about some poor resident just sitting there
That's right.
reading through
Circling,
an
yep.
ECG. You know that guy probably called up his computer nerd buddy and was like, "Hey man, we have got to get some AI for this. We have got to because this is killing me here."
That's right. That's right.
So, but yeah, that's a great technology that we have out there now is being able to do these long-term monitoring ECGs and get this data because that was a big struggle for a long time trying to characterize these arrhythmias because they may not happen every single time. And so being able to monitor them long term and figure out what's going on.
It's huge. And to be able to monitor them in the moment,
Right.
especially under exercise conditions, it's really allowed us to understand what's going on with, anything from, I have this elite 5-star eventer that for some reason is just starting to have trouble about 2 minutes into the ride, and you look on course, what's the horse being asked to do? We can now GPS, look at what the horse is doing on GPS.
Cool.
Oh, that's
Look
really
at
cool.
rate and rhythm, and then, we can put systems on that can define, okay, that horse just had a whole run of VPCs while doing this.
Oh,
well, that's concerning, or this horse, for sudden collapse, again, what we're seeing is, particularly in race horses, atrial fibrillation is a pretty significant thing. And it's to the point that these racehorse trainers will actually have a handheld device they can at least slap on that horse right after it comes out to say, you ran poorly, let's make sure this rhythm's normal right now. So again, there's a lot that's coming down the pipeline as well with this is continuing to grow, and I think it's going to grow at a very rapid pace now that we've got AI. There are apps that can, you could get a polar monitor, which is just simply kind of a heart rate monitor, and can do some kind of rough ECGs basically, but you can put it through an app called Equifib, and it can detect if they think AFib's occurring at any point in time.
Wow, that's
so it can be things that we can even set up riders with that we can leave for them to use in their normal competitions, exercise, whatnot, to look at fitness as well. Okay, may not be an arrhythmia, but why is my horse now, that heart rate should be at a better place, so maybe I need to do better conditioning.
Good point.
So we're looking at all sorts of exercise physiology aspects that this will, I think, eventually be very valuable for.
That's so cool. Like, I didn't realize that it had, because I think the Televet thing, it was an app that it was a little bit newer, I think, when I was in school and we were doing an AFib case. And I was like, wow, this is so neat. But yeah, it sounds like it's grown even a lot since then.
has,
That's just so amazing. Technology's so cool.
It is cool.
I know that. Because that's one of the things. Like a lot of times where you're dealing with some of these issues, is you're trying to recreate it in a hospital setting, and it's very difficult.
Yeah.
But the fact that we've got technology out there that we can monitor these horses at work in their normal, because when you really think about competition, it's not just we're exercising so our heart rate goes up. We have to take some of the physiologic stressors that occur with exercise
That's
as
right.
well. Like now we're out there on course and we've got adrenaline playing a role. There's these other cortisols up. We've got these exterior, or I guess internal stressors that may not be there
That's right.
in an evaluation. So to be able to get that information, especially you talk about GPS.
Yeah.
I mean, I was sitting here thinking, I was like, if you could track GPS with it, and somebody's like, yeah, when I got to the third jump on cross country, this happened. Well, you know what? We can go back and with this technology, you can go back and say, okay, well, nothing happened, or this happened.
Exactly.
Yeah.
Exactly.
That's huge.
It's huge. It's huge. Actually, I'd say UPenn is probably the group that's doing the biggest amount of work with this. But Chris Navas, that is his thing. I mean, he's got people who are just will send him exercise. Here's my study from my horse today. I went out and did this, and this is what I noted, and you know, and it's gonna, again, I think it's kind of where things are going in that direction, that it will continue to.
If you look
grow.
professional athletes on the human side, it's already there.
It's already there.
I mean,
That's right.
they're watching this very, very carefully. And again, it's not just from is there a problem, but athletic trainers look at like how fit do I have this individual.
That's right.
And that's really critical, I think, for especially when you're talking about the 3-day horses that are out there on those longer cross country courses. This is critical.
It's critical. It is critical. And then, you know, but the other thing is we keep mentioning race horses, 3-day horses, but I think of barrel racers as well.
I was about to go there.
These are horses we're just throwing in a chute. They're going max out,
Yes.
you know, hard. You know, it's a shorter period of time, but that heart rate's getting just as high. You know, again, that's in a population that, yeah, that's important that we're looking at, you know, and evaluating those horses for sure.
I was just thinking like that because, you know, a barrel run may only be 15 seconds, but I always say it's not just that 15 seconds. It's like you've got warm up going in. You've got, like, when you talk about adrenaline, these horses they're having this and they're going in maxed out.
That's right.
And so that's a population that I've often wondered, is it going undiagnosed?
I have too. I think I think that's an area that would be really good for us to look a little further into.
Because I've seen it from an airway perspective, because I remember when I was in vet school, the thought was like, well, they can hold their breath and run a barrel pattern. Not true, because I have some horses that try to hold their breath and run. and it's funny because they're like, yeah, it's just like, he's just kind of like, and holds his breath as long as he can, then finally breathes again during this run. And I've seen a lot of different issues with airways.
Yes.
Beyond just, we always think about in barrel horses, the exercise-induced pulmonary hemorrhage or the bleeders, but there's a lot of other issues, dorsal displacements, a soft palate. That's a big one in my opinion that goes really undiagnosed. And I've often wondered, what other underlying things are there? Are we having some cardiac issues? And again, are we fit enough to make these runs? Yes, it may only be a 15-second run, but that's 15 seconds of everything they've got.
That's right. And I think that's a huge part of, do we get them fit enough for that? And that's where, again, some of these heart rate monitoring while exercising and running, you know, doing, you know, if you're doing trot sets, whatever you're going to do to leg that horse up to that, you know, and increase that might be helpful to say, well, yeah, this horse is performing great at this run, and now he's doing it at this heart rate here versus it was up. So he's fitter. He's more prepared. You know, I've done my training there. I think that's a really, and again, the airway, I wonder too how much that could overlap, particularly in some cases. I think it's I think it'll be an area that we should get into and look at a little bit more as cardiologists and exercise physiologists, all at respiratory people, dynamic scope. These horses will just be all hooked up.
I think it's really interesting because, you know, often we compare a lot of things to humans, and I think about, like, if you're an Olympic level sprinter, you still have to have, like, you may only be running 100 yards. You may be the guy that sprints 100 yards, but your heart still has to be conditioned. The body still has to be conditioned. It's like they're still doing distance training. They don't just go out there and be like, oh, let me just sprint down through here. Right. Like, they're still doing a lot of things to get where they can make that sprint happen. Yeah. And so I relate a lot of that back to horses. And like I said, when you do look at barrel horses, it may only be 15, 16 seconds in the arena. But that's a lot. A lot goes on that 15, 16 seconds. Yeah. I mean, you look at those heart rates and they're coming out at 220, 225.
Oh, yeah.
All the time. So
And just to get up that fast, that quickly too,
Yes.
that's a lot of work.
It's a lot of work. Yeah.
it'd be kind of interesting if maybe that solves our EIPH issue. You know,
I
I thought about
I don't
that.
think it will,
It
but
won't, unfortunately. I wish it would. I wish it would. But you made the comment about the portability of equipment and I do think that just, as we were talking about this, it used to be that we had to bring a horse in somewhere with with a treadmill.
right.
And we'd
Yes.
have to instrument them up
Yep.
and run them on a treadmill to do all this because we didn't have the Bluetooth technology, radio telemetry technology. And now, and not every horse that's not necessarily mimicking what they're doing out there.
No.
Right.
And so how wonderful it is to have this technology that, yes, we can take to the horse, mimic more what their normal environment is or what they're being asked to do, maybe create some of that more adrenaline type response that we need
Right.
to see. In fact, they call it a cow test at Penn, where they'll just pull out the cow and see if the horse spooks at it
Yeah.
and see if it develops an arrhythmia.
I
But we
mean,
can find some
yeah.
cows or llamas or whatever.
Very
that-
scientific.
Deer, running through our woods, but
Simple works.
some little things that just make them,
Yeah.
have that adrenaline rush and see.
No, and
But
'cause
we're lucky that we have this now,
Mm-hmm.
this mobility of this.
Because I remember the treadmill days. I'll never forget the first one I was involved with. It's like, okay, so I'm going to get this horse on this treadmill. A horse that doesn't really like to even go on a trailer, and we're going to get him on a treadmill. And it's amazing how well they adapt to it and how
Yes.
quickly. But again, we're going to go straight on
Yeah.
a treadmill. We're not recreating that same scenario. By
right.
recreating that, we can get so many more answers.
Yeah.
So like put riders up. I mean, it's really cool, the technology that's out there and what we're able to do.
Yeah.
So, well, Dr. Whelchel, thanks for being here today. And like I said, if y'all have got cardiac issues, give us a call here at Countryside. Or, again, she's with Equine Medicine Consulting Services. If you're in the metro Atlanta area, she can definitely help you out with this. It's a great, great resource because there's not many of you out there. So we're really, really lucky to have you on board helping us out here with this. And I want to give a special thanks to you for being here today. Dr. Brown, thanks for being here. April, thanks for recording all this. Casey, thanks for doing all the editing. And to all our listeners, thanks for making this podcast successful. And we look forward to hearing from y'all again. Take care. Bye.
Bye.
Bye-bye.